So I've been having excruciating knee pain. It's been driving me crazy because I'm a runner and I have not been able to run for the past 2 months or so. I'm actually also a yoga teacher and I work for Evolution Physical Therapy, so I know that they're going to be able to help me get back on track and fix this knee issue. So I'm headed in today to have a physical therapy appointment, and I am so excited because I can't wait to get back on my feet and be able to start running again, and also just not to be in pain all the time.
What's going on, Dorian? Okay.
I've been having some dull aching pain in this right knee. It's really been bothering me quite a bit.
Oh no. So when does it hurt most?
It hurts a lot if I try to run. I'm a runner, so that's been annoying. And also going up and down stairs has been kind of a problem.
Okay, is it more painful going downstairs than upstairs?
It is, yeah, it is.
Okay. So just as I expected, this is a very common knee pain that we get with a lot of patients. Technically, it's called patellofemoral syndrome, what used to be known as chondromalacia. So it's very preventable and it's very fixable. So let's get to it. And you see how this knee wants to roll in this way?
Yeah.
That's the weakness that we're seeing here in the hip.
Okay.
And so what happens then is the kneecap rolls out to the side. So what we're going to do is focus on strengthening your glute muscles to allow that hip to be in a perfect position to allow the patella to slide straight up and down the way it's supposed to.
Okay.
So this is what we're going to do for Johanna. We're going to structure her physical therapy regimen in 3 separate parts. So we're going to start out very simple, give her some really basic exercises, let the body heal itself, let the knee inflammation go down a little bit. And then when she comes back over the next 2 to 4 weeks, what we're going to do is progressively increase her exercises and get her back out running again. So the first thing I'm going to have you do, Johanna, is go ahead and lie down on your back. And I noticed that the hamstring was a little bit tight on that right side. So this is a typical yoga strap. Go ahead and drop this around the mid part of the foot. Okay, let's keep this leg straight down. Okay, so we're going to keep this knee nice and straight. And then just use your arms and kind of bring that leg across your body so you feel that stretch in the outside parts of the hamstrings here. And then very gently just ease your leg across your body this way so you feel that stretch kind of on the outside of that hamstring. Okay, does that make sense? Okay, you're going to hold each one of these stretches for about 20 seconds. Do each side 3 times. Do it twice a day. Okay, so the next stretch we're going to do is designed for the tight hip muscles. Okay, so what I want you to do is bring that right leg up, cross it over your left knee. I want you to reach through your legs now, grab onto the back of the left knee and pull that knee up toward your chest. Feel a little bit of a stretch there in the hip?
I do, yeah.
Perfect. So just like the hamstring stretches, you should do this 3 times, hold each one for 20 seconds, and do it twice a day. Now this next exercise is designed to really get the glutes firing. We got to strengthen those muscles like we talked about, get the glute max, glute medius really firing and strong. Okay, so what we want you to do from here is go ahead and pull the belly button in toward the spine, hold that contraction, now squeeze your glutes together, and then use that contraction to lift up off the table. Good, nice, slow and controlled, and then come back down. Try to keep those abdominal muscles engaged the whole time. So if you're feeling this exercise in the hamstrings or the back of your legs, which is really common, you're overusing those muscles. So really focus on squeezing the glutes and using that contraction to lift you up in the air, not the hamstrings. Okay, so the last exercise I want you to start out with is designed for the gluteus medius. So the muscle is right on the side here. So go ahead and roll to your left side. Okay, we're going to straighten that right leg out. Keep the left knee bent for your back. Okay, and stay nice and long through here. So what you're going to do, Johanna, is go ahead and just lift that leg up in the air and right back down. Okay. And if you've got this condition at home, I think probably what you're going to notice as you do this exercise is that foot and leg is going to start to want to drift forward because the body's trying to not use the weak muscle. So one way to avoid that is if you can, set yourself up with a wall right here and you're sliding that heel on the wall as you do that exercise. That's going to prevent that foot from coming forward. So here's what we're going to do. I'm going to send you home with all these exercises. You're going to do them every single day. Come back in next week, we'll see how you're doing, and if everything is going well, what we're going to do is advance those exercises, okay?
Okay, sounds good.
Perfect. So you guys at home, if you're playing along and you have knee pain, and you're having some of these issues, make sure and leave a comment below if you're having any problems doing these exercises. And then check back in for Johanna's next visit and see if we can't progress your exercises at home.
So I'm feeling good. First session is done, and mainly I'm really excited because the knee pain just been bugging me so bad. So I can't wait to get back to running and back to just being able to spend my day without having to worry about the knee pain all the time. The exercises seem very doable and manageable, so I think I can tell that they're going to help because I can tell how weak my hip is, but they definitely seem doable. I feel just a lot of motivation being in this clinic. There's just a really good air of excitement, and I feel very confident that I'm gonna see improvements and be able to feel better and definitely have less pain going forward.